Hi everyone, welcome to today's video that will be going in depth into some of the careers that are possible in medicine. So first, some of the objectives. We're going to learn about the different types of career options, understand the educational path for health professionals, and also have a brief discussion on what the possible future directions are for healthcare professionals. And since I personally am a fourth-year medical student, a lot of the emphasis will be on what it's like to be a medical student and what that route is like for being a physician. We'll touch a little bit briefly on some of the other professions like physician assistants, APRNs, and nurses. But for more information and more insight for those career options, it would be best to talk to people who are actually in the profession, who are going to school for the profession to get the best idea there. So first, the highlighted professions in blue, that's what we'll be focusing a little bit more on. But the types of career options in medicine are very widespread. There are so many different routes that you can take. And so that's one of the best parts within medicine. It can also make it challenging to navigate. So that's why we're going to be touching on some of them today. So first, what is the job for physicians? Physicians generally, they focus on being leaders by diagnosing and treating patients, and many times their jobs will involve taking a history, conducting a physical exam, and interpreting labs and imaging, and that's really done to prescribe treatments or down the line do surgeries. So there are many different types of physicians, and depending on the field that you end up specializing in, you can be focusing on a lot of these skills, or potentially you could be, if you're a radiologist, working primarily on the imaging aspect of it. Or if you're a pathologist, maybe you would be mostly on the lab testing side and understanding what the histology of slides would be. So depending on which part of medicine you go into, you can really take advantage of some of the skills described on this initial slide that you learn really in medical school. So some of the important skills that physicians end up needing are, of course, communication, social skills, compassion, patience. These are all things that are required because most physicians end up working pretty directly with a wide host of people, whether that's their patients or other members on the healthcare team. So there are a wide variety of different settings that physicians can actually work in. So those include private practice, hospital employees, and also they can provide outpatient services, which would be more like in their clinics. So these are just sort of the basic breakdowns. A lot of people have been moving more towards being employed by hospitals. That's the current trend, but that could potentially change depending on how the climate looks like for private practice moving forward. So depending on the type of work you do, you might have to be in a hospital, or maybe depending on the type of work you do, you might be able to have your own private practice. A lot of dermatologists and plastic surgeons, for example, will still have their own private practice. So aside from that, one of the things to kind of keep at the back of your mind is that there's a big shortage in healthcare providers. And so going into medicine, there's a good chance that you'll have a job moving forward because there is, for example, there's a big physician shortage, but just overall, there's a huge shortage in healthcare providers. So what is the route to becoming a physician? So first, the educational path is perhaps one of the longest for healthcare workers. If you become a physician, it really starts early on during your undergraduate time. You are focused on, doing some shadowing, getting some experience in the hospital, volunteering. You want to have a good GPA. And so there's a science GPA and non-science GPA. Both are very important. You will spend a lot of time focusing on your pre-medical requirements. And so that ends up taking into account, for example, your major, making that decision as well. So there are plenty of medical students. I myself didn't do a science major. I ended up doing a public policy major, but it definitely made it harder to fulfill some of those pre-med requirements. That being said, I definitely don't regret it, but it's something to keep in mind that you'll have to plan for. Other than that, a lot of students will get involved in research to really understand what that process is like, and it comes in handy when you're in medical school and later applying into residencies as well. extracurricular activities, if you're able to show that you are genuinely interested in medicine and helping your community, that can always be good. And getting involved in any sort of teaching position could also be helpful. And that way you are able to get involved in some of the more academic aspects to your institution, and that's something that can also carry on in medical school or down the line in residency. And keeping in mind any sort of awards, recognitions that you might get, and your letters of recommendation end up also being very important. So basically, your whole goal is to prove to a medical school why during this time are you interested in medicine? Why do you want to become a doctor? And so that's really what you're trying to do. And it's also for yourself to figure out if this is the kind of career path you want to take. There are people who end up having a whole other alternative career, and then they end up going through something like a post-bac program, and they go into medicine later. So it's not like you have to go through the traditional route of doing some sort of a pre-med major and pre-med program. There are plenty of people that have a whole other career and then join medicine. So after that, you end up going to medical school, and that can be in a couple different forms. So you can go to school to get an MD or a DO. And so now the residencies are sort of combining some of these programs. The requirements end up being a little bit different if you end up going to a DO school. So you may have to take additional exams. There's a little bit of a different focus in the type of medicine you learn. And so I definitely encourage you to talk to advisors as to, like, from your institution, or maybe people who have actually gone to these DO schools, to see whether that's the right career option for you. But otherwise, a lot of the activities that you do in medical school, they're actually pretty similar to the things that you started in undergrad, but they're a little bit more focused. And now instead of medical school, you're thinking about the next step, which would be residency. So again, you have your same things like your clerkship grades, your national exams like the steps, instead of the MCAT, and you're still doing volunteering, you're still worried about your letters of recommendation, extracurricular activities, and getting some of that teaching and research experience. And basically during this time, you want to be showing to residencies why you're particularly interested in that field and how you're going to be a productive member in that field. So I think that would be the main takeaway for medical school, is really just trying to get a solid foundation and showing that you've been productive with your time. Then after that, you have residency. And residency is when you get the real on the ground training. That's when you are actually able to get a lot of the hands-on experience. Although you do get some of that in medical school on your clinical rotations, you have a lot more autonomy in residency. And that's when people choose which particular field of medicine they end up going into. And so I have a slide on the different types of residency programs, but the main takeaway here is that it can range in length depending on the type of field that you go into. And so it can be anywhere between 3 to 7 years. And that is something that a lot of people consider, especially because they want to determine how many additional years of training they want to do after their undergraduate and DO studies or MD studies have been completed. So similarly, if you are planning to do a fellowship, which means that you're going to have like a specialization in the field of your residency that you've completed, then you're also focused on some of the similar things of having strong research in your field, letters of recommendation, and then also getting involved in some of the leadership and teaching opportunities, just to show that you've been really committed to the field and also have been a positive impact in your institution. So after that, you can go on to fellowship, and that's when a lot of people might spend a year for their fellowship. It might be more, it could be 3 years. And depending on that, you are then subspecialized and you can be an interventional cardiologist. So depending on what you want to do, the path can be pretty long. And so the average salary based off of the US Bureau of Labor Statistics, which is the website I got all of the salary information from, that showed a median salary of $208,000. And if you specialize, it tends to be a higher salary. If you tend to do primary care fields, tends to be on the lower end. And So although the salary is very high, one thing to also keep in mind is that the educational route is very long and there's also a lot of debt that's involved. So average student will have 200,000 in debt, but I know many students that have far more. So it's something that's of course important to think about, especially when you're considering things like medical school versus a different career option, or even specialization versus no specialization. So all of these things are important to take into consideration when you're trying to figure out what you want to do. And I think that depending on where you go, for example, here in Nevada, the tuition is quite reasonable for in-state students, especially because scholarships are also given out. And I think it's something important to think about, not necessarily the only thing that will guide your decision making, but at least is something to keep in the back of your mind as these loans accumulate interest over time. So some popular residencies, again, this is when you get the hands-on training, and there's a whole wide variety of them. You can go into internal medicine, family medicine. Family medicine, you're able to see women, children, your average sort of day-to-day patient, pediatrics, emergency medicine, psychiatry, anesthesiology, general surgery, and then there's a bunch of surgical specialties you can go into as well, OB-GYN. So, I mean, the options are pretty diverse. And so I think it's important to get as much exposure as possible to these different fields if you're interested in them early on. So that way you can have a better idea once you're in medical school and can gear some of your activities towards it. So another thing to consider is that if you become a physician, the options are quite widespread for you. I think that although most people will be a practicing physician, and that could again be like what we talked about in more of the private practice setting, or the hospital setting, while there are those options, there are also other different ways that physicians have been getting involved and have been working. So of course, in public health and the government, we've seen that a lot this year with the COVID-19 pandemic. There are plenty of physician leaders that are working on healthcare policies, on public health research, and it's, I think, an expanding field. You see physicians going into consulting as well and help out with the healthcare problems that companies end up facing. Doctors can also work in insurance and pharma. They can work with medical device companies. Scientific research is very common if you're in an academic setting, especially. It's very likely that you will be asked to do research. There are also opportunities for doctors to be business owners. Of course, what comes to mind is like the private practice setting, but there are other ways that doctors have been running their own businesses. And then again, in law, you'll see sometimes physicians will get called in for cases and such. So there's a whole host of areas that physicians can work in, and it's a pretty interdisciplinary field if you are ending up, looking to find those opportunities. So there are some interesting issues surrounding what it's going to be like for the working climate for physicians. So the AAMC actually has a 15-year outlook that was published actually this year, and it's basically saying that by 2033, the demand for physicians will far outweigh the supply, and the projected range that they had was 54,100 to 139,000 of full-time equivalent physicians. So that's a very significant demand that would be required for physicians. And so they looked at two different areas: primary care physicians, which the shortfall could be anywhere between 21,400 to 55,200 physicians. Non-primary care physicians, the shortfall could be anywhere between 33,700 to 86,700 non-primary care physicians. And so that would also be including 17,100 to 28,700 surgical specialists. So there are shortages basically across the board, and there's a good chance that your services will be in demand in the future if you choose to become a physician or choose to go into healthcare. And so the question might become, what is driving this shortfall? And Of course, it's a whole host of different things, including how difficult and long it really takes to become a physician, because it's costly, both financially and also in a time-wise manner. But the external factors really would be pointing more towards the population growth and the aging population here in the US. So the population is projected to grow by around 10% up to 361 million, which is significant. And also, not only is the population increasing, but the population of the elderly, so those who are 65 and older, is actually projected to grow by 45.1%, which is a huge population considering that a lot of the healthcare services that physicians provide are meant for the unhealthy, and so the elderly often fit into that category. So this means that any sort of physician specialty, especially those that are directed towards the elderly population, they're likely to be in demand moving forward. So in addition to that, there are some other trends. There may be moderate increases in the use of APRNs and PAs, especially because the path to becoming an APRN or PA is a little bit shorter and there's a significant need for their services. Then there may also be alternative settings, such as retail clinics. So instead of having your primary care clinic, you might have these retail clinics that have been set up. And then there might also be changes in how payment and delivery is done. So a lot of the ways that physicians get paid or the way that services are done and reimbursed, that could potentially change because it's just based off of the legislative, the laws essentially, and the regulations. So a little bit more information about the diversity of the physician workforce. There primarily is a white population of physicians, and then Asian, then goes down to Hispanic, and then Black. It is a field that is currently working on becoming more diverse, and there are many institutional programs out there now that are really pushing for increased diversity, which I think is really important. So that's always a question to ask when you go to a medical school or an institution, is to see how much they prioritize it. So now moving on to some other different roles. The physician assistant. So here's a very brief description. But generally, physician assistants will work in team settings, and most of the time it's under supervision of a physician. And they work in a very similar context to the doctors. So they will take patient histories, conduct physical exams, often do notes, and they'll aid in the diagnosis and treatment of patients. And they basically can work in any field that they want. You go to PA school, and then after you go into PA school, you can work in a particular field of medicine that you decide to choose, essentially. And a lot of the skills are very similar to what you need as a physician, which are just the communication, social skills, compassion, the ability to work in a team, because a lot of your work will be involving a team-based effort. And the median salary I found was 112K. I found this interesting website about how it was talking about the cost, like not the cost, the average pay per hour for PA, and compared that to an MD. And it was actually very similar, because although the compensation for MDs is higher, technically the median salary is higher, the hours worked is also different, and then the amount of loans that get accumulated over the years are also different. So anyway, the point is there's some really interesting calculations out there. I encourage you to Google if you're interested in learning more about that. The route for PA, so first there's an undergraduate degree similar to pre-med requirements. There are pre-PA course requirements, and your transcripts will matter, your letters of recommendation will matter. And for being a PA, having healthcare and patient care experience hours is really important. So there's generally 1,000 of them, but I think those may depend on the program you're applying to. And the PA school process is actually 26 months. And essentially the point of the PA schools, the first year will be a lot of book work, and then the next will be your clinical, and you are going to be having to pass the PANCE, which is like the major exam that you need to be able to pass to be able to get a job. And so one of the benefits, I think, of the PA route is that there's a lot of flexibility. If you potentially wanted to change over fields, I think that is more possible. Whereas I think going to medical school, you'll be locked into the residency that you end up going into. So there is a little bit more flexibility here. Next is the nurse practitioner. So these are also called APRNs, and interestingly, APRNs can work in a variety of settings as well, and they're nurse midwives, they're nurse anesthetists, and they all have the similar qualification of being a nurse practitioner. And so the independence of how they practice, it actually varies by state, and I think it's similar with PAs as well. And so here it kind of shows where nurse practitioners are allowed to fully practice, or where there's reduced practice or restricted practice. And so basically a lot of their licensing, that means, also ends up depending on the state. And similar to physicians, they will take histories, do physical exams, work on notes, and just do the diagnosis and treatments of patients. And so they have an average salary of about $115K. And the route to being a nurse practitioner, so generally nurse practitioners will have a bachelor's of nursing, which will take about 4 years, and then they'll get like a master's or a doctorate of nursing, and so that might be 2 to 3 years, and at that time you'd be accumulating clinical hours, and then there's a national exam that has to be taken, and then I believe the state licensure actually varies depending on the state that you're going to be working in, and the capability, the ability for you to practice, how fully or how restricted, that also changes state by state, perhaps in line with some of the shortages that states have been facing. Aside from APRNs, there are also registered nurses, and you work so closely with nurses when you're in the hospital. They are absolutely integral to the care team. So they work in really coordinating patient care. They're sort of like the first line, you know, they're always with the patients, or they have a lot of contact with the patients. Generally speaking, they can work in a variety of fields as well. And they help with administering meds, help with doing diagnostic tests, and often will collaborate with our healthcare team members. And what's essential for nurses, you know, similar to the other fields, communication, critical thinking skills. Nurses are often very busy and have really like important role in the hospital system. Their salary generally tends to be around 73,000 for average, and in order to become a nurse, there are different options that are also available. So you can get nursing diplomas, and so those you can get at community colleges or vocational schools. An associate degree nursing, which is only around 2 years. Bachelor's of Science in Nursing is 4 years, so you can do that for your bachelor's degree if you're in college, and then that can open a lot of doors for you to be working as a registered nurse. You can also get a Master's of Science in Nursing, and then also doctoral degrees. So aside from these members of the healthcare team, so the ones that we discussed today, they're really the type of healthcare providers you work with almost on a daily basis, or you'll see them quite frequently depending on what part of medicine you work in. So I think it's really important to understand what the different roles can be, what your role can be in medicine if that's what you're interested in pursuing, and some other sort of interesting things to think about for the future of medicine. There are so many different opportunities available to you, and I think that's what is the exciting part. It's pretty broad. With the COVID-19 pandemic, although we had already been seeing trends in telemedicine, it had only really sped up with the COVID-19 pandemic. So basically, especially in places like Nevada, where a lot of the population is rural, it can be really challenging to deliver healthcare or get people to come into the clinic for especially more basic healthcare problems. So telemedicine is something that I'm sure will grow and expand. Similarly, as we had mentioned before, there's a significant aging population, and so medicine or healthcare services that end up focusing on the elderly population especially will become very important. There's also AI, so very interesting work that is being done with augmented intelligence and using more technology and analyzing large amounts of data to improve treatments and also understand a little bit more prognosis. So we see that in actually really all fields of medicine, but mostly in radiology. It's already been pretty well established with imaging softwares and technology, a little bit in dermatology and pathology, but again, it's being used in a wide variety of fields, and you can see it in oncology, among other spaces. So preventative medicine is also very important, and it's going to be, especially with the aging population, but also the idea that preventative medicine, it's easier to prevent a condition. It's far cheaper also to do that than it is to generally treat the condition in many cases. And aside from that, there's some really cool biotechnology medical device companies out there that are doing some very innovative work to really advance the field. And so there are actually so many different options in medicine that if you're interested in a particular field, you will have so many different opportunities available to you. So I hope you pick this career, pick this field, and have enjoyed this presentation. As mentioned before, it's a far advancing field. You can work in technology, in health, in law, in statistics, and research. And it's really an all-encompassing field. So thank you so much for your attention. And I really hope that you enjoyed this presentation, and let us know if you have any questions.